Welcome to the EAU podcast. In this History Office episode, Loek Keizer and Jonathan Goddard explore the history of British prostate surgery and the development of urology nursing. Join us as we revisit the milestones, innovations, and individuals who have shaped modern urological practice.
Welcome to the EAU podcast, and today we have another historically themed episode for you, but it's also related to the upcoming annual Congress in London, which for the listeners should be next week. That's exciting. My name is Loek Keizer. I am an editor working for the EAU in Arnhem at the Central Office. I work closely with the EAU's History Office, and I'm the author of EAU 50, which is a book on the first 50 years of the EAU. And I'm joined by Mr. Jonathan Goddard. Hello, Jonathan.
Hello.
Urological surgeon based in Leicester, the UK. You've been a member of the EAU History Office for close to 10 years. And you are the curator of the Baus Museum of Urology.
I am.
Welcome.
Thank you very much, Luke. Thank you.
We'll be talking today about, our activities in London, of which you will play a part. Let's start with the exhibition, because every year the History Office organizes a historical exhibition, which is part of the EAU Square and the wider exhibition. Jonathan, why do we do this?
Well, there are several reasons. I mean, the main reason really is because history is so important. I mean, I am biased, of course, being in the History Office and being a historian, but it is really important. Everything we do now is based on things that went before. And there are multiple quotes about that, but essentially it means you need to look backwards before you start thrusting forwards. Otherwise, you make the same mistakes as other people. The other reason is people really enjoy it. I've been helping with this for, like you say, nearly 10 years. And the number of people that absolutely love coming and seeing the various things that we manage to find each year, often related to the country we're in, but not always, usually related to the history of urology, but again, not always. Fascinating things. And people love to see it, particularly the old instruments, and they relate to what they do every day. The stories, everyone loves stories. Everyone loves to hear about other people. So, and it's a learning experience, really. People, I don't think some people would appreciate how important history is, but it really does matter today and also in the future.
I imagine for urologists, it really comes alive when you see instruments that your predecessors were still using.
Absolutely. And often people are quite surprised how similar they are. Obviously, we're very lucky. We're using robots and we're using lots of things. But if you look at the end of what's on those robotic instruments, often they're no different to what our predecessors used in the 18th, 19th century, sometimes even earlier.
Well, you mentioned we'd like to have a local flavor to these historical exhibitions, matching the country where the annual Congress is taking place. So clearly this year we will have several British themes and with items brought in by you. We have items related to prostate surgery in Britain or the British Isles and urology nursing. Let's first talk a bit about prostate surgery.
So I wanted to pick a particular topic. In last time we came to London, we had a lovely historical display looking at the overall history of urology in Great Britain. So I didn't want to repeat that. So I've picked a particular topic and I've looked at the prostate. Now, obviously, surgery and the understanding of the prostate is an international story. So, but what I've done here is I've tried to pick the links that relate to what happened in Great Britain to tell the story. And we've also brought, as you say, lots of nice things to look at, lots of nice artifacts that help to tell the story, which is, of course, written in the booklet, which everyone gets. So you can bring a booklet along, read the story as you look at these amazing things.
Yes, every Congress delegate within their bag will have the historical exhibition brochure, which features some background information on the items on display. The brochure also covers the story of prostate surgery in the last 200 years or so in the UK, featuring some big names like Thompson, Millen, and more recently, Blandy.
Absolutely. And these are names that people, to some extent, they remember these names. I mean, maybe not Henry Thompson. I mean, he comes up a lot in the history sessions, but there'll be people that remember John Blandy. He was a British surgeon very closely linked with the EAU and working in Europe. And really one of the pioneers of TURP in Great Britain, which you might think is a bit odd because this was quite late on. Millen, everyone's heard of Millen with his famous open operation, but he actually was a great proponent of minimal invasive surgery before the Second World War in the 1930s, working with Canny Ryle in London, and they set up their own hospital, or Canny Ryle set up this hospital, Millen worked for him. And it was the whole point of this hospital was minimally invasive surgery. And this was in the first part of the 20th century.
Although one of the instruments that you will have on display is the prostatic punch, which is something that's gone a bit out of favor.
Yeah. I like to show examples of the punch because it's the story is very similar to TURP, but it is, on the other hand, quite different. Now, this prostatic endoscopic surgery really is an American story. And in the GB start of the Great British story, part of the story is really the fact that we were less keen on doing this. There were people like Millen, Canny Ryle, Kenneth Walker, really pushed before the Second World War, but it didn't really take off in the UK until quite late on. Multiple reasons for that. Firstly, I think historically we don't like to be rushed into things. We like to take our time. The other point that many people have said is obviously throughout Europe, all these young men who are urologists had been skilled in surgery in wartime, 2 huge world wars. So they're skilled in open surgery. And particularly after the Second World War, Terence Millen introduces this lovely open operation for the bladder outflow obstruction and open prostatectomy. And it's relatively easy to do. If you have any skill as an open surgeon, you could do this. Now, urologists are very skilled using the cystoscope and endoscopic tools, and that's a lot more difficult. So why try and learn this much more difficult technique if you can do an open surgery, which you're used to doing every day? And this was general surgeons, not just urologists. We now know the answer. The answer is because endoscopic surgery is much safer. The outcomes are much better, but it took a long time for that to appear. And in fact, the paper was published in 1980, which was quite late, really started to tip the general surgeons to give up the prostate in the UK back to the urologists. So yeah, it's a slightly different story, I think, in the UK.
The name punch lives on in a club, I believe.
Yes, yeah. So the punch, it was slightly different. So people who are used to doing a TURP, if they look at the old instruments in the display, they will recognize a resectoscope. The punch is different. It doesn't have such a complex lens system. It's essentially like looking down a tube, really. Instead of using electrical current to cut the prostate, a knife punches a piece of prostate, and then you use an electricity to cauterize those bleeding points. So it's quite a skilled thing to do. Now, there was a group of men after the Second World War in the UK who were really keen on using this American invention. They realized that in the right hands with the right training, actually, it was really good. And they've shown that in published papers. But the skills required were quite great, and it was quite a difficult learning curve. So what they did is they would move around every year. They'd go for a little trip to each other's hospitals. One person each year would say, come to see me, bring your partners, we'll take you through some cases together, and then we'll all go out for dinner. And that still happens now in that a group of urologists will meet in a different city every year. They will have lectures about urology, but their families come along as well, and there's often social things as well. But there is no one, I don't think there's anyone in the Punch Club at the moment who's probably ever used a punch. It's more of a general urology educational club now.
Any idea when the punch was last employed?
Well, there are a couple of examples of the punch after the introduction of the Hopkins lens in the 1970s. I've seen those. So the Hopkins lens, of course, revolutionized endoscopic urology. And I think that's what pushed the punch out and pushed the TURP forward. There were surgeons using the punch certainly into the 1980s, maybe a little beyond. Certainly my old bosses had used it in the past, but even then they were probably using it in their training. The last example I was aware of, one of my colleagues doing some MD research here in the Midlands in the UK, used the punch to get clean specimens of prostate for research, because electrical diathermy wasn't used. You literally take a punch with a sharp knife, and he used it to get those before quickly going under the resectoscope and finishing the TURP. So, but that was really for research. So yeah, and no one, as far as I know, uses the punch, and I don't think anyone sells them anymore.
Well, people can have a look at the exhibition to see a historic example of that instrument. Another part of the exhibition will cover nursing, and specifically urology nursing within the UK, which is an interesting story I found. For instance, the term registered nurse, RN, which everybody is quite accustomed to, but it's very literal in that a register was set up in 1919. Could you talk a bit about the origin of this?
Well, it is an interesting story. I think we've been a little lax in talking about the history of our nursing colleagues, which is equally important, of course. And the nurses in the past were not like nurses now. So if you look at examples in the early 19th century, you will find that really they were very much looked down on. So these were often very poor women that came to help in the hospitals, but also were employed privately. If you had no family members to look after you, you'd expect a family member to nurse you in your own home. And in the stories of Charles Dickens, famously, that the nurses are seen as drunk, dirty, just in it for the money, and almost criminal. Florence Nightingale, we remember as the first modern nurse from the 1850s. And she again writes about the nurses at the time being just not fit for purpose, if you like, and then starts to introduce training of more educated ladies, and made the nursing a profession that it was acceptable for ladies to go into. There wasn't very many things ladies could go into, really, if you were middle class, or rather than working class and working in a factory. And the nurses really wanted to prove themselves, not just go to a nursing school, but to be shown that they were qualified to do this. And a register was finally, after many years of pushing the government, a register was introduced for nursing, a little bit like the GMC, the British Medical Council register that we're all on now, to say that, yes, you are qualified to do this job. And as you say, it was quite late, 1919. And as you say, it is literally a list of names. A registered nurse, you're on the list.
And we will have some items related to this early period of nursing.
Yes. If you were to look at the cartoon nurse, you'd see a particular uniform. We don't tend to see those anymore in the hospitals, which practically I understand, but it is a little bit of a shame. So we've managed to get an old nursing uniform, but also we managed to get hold of something called a chatelaine, which is what the nurses would carry their personal instruments on, because, of course, nursing uniforms don't often have pockets, and it's slung from a belt. And it's quite interesting to see what sort of things they carried around with them. And then perhaps to think, how on earth did you keep those things clean? So, as you know, nowadays, if you want to do something on the ward, we go and set up a little trolley specifically to do it. And they literally had them swinging from their belts. And we're also very lucky to have an original letter from Florence Nightingale on loan from the museum in Leicester, which is a nice thing to be able to see face to face, as it were.
And our brochure and the exhibition also covers the foundation of the British Association of Urology Nurses, and which is, of course, similar to the EAUN, a predecessor of that organization.
Yeah, so we work very closely with specialist urology nurses now, clinical nurse specialists, and that's an interesting story as well. So these nurses developed in the latter quarter of the 20th century in the United Kingdom as nurses progressed through the ranks, as it were. They tended to be pushed more into managerial posts, so that the sister on the ward would end up doing a lot of paperwork and sorting out of rotas rather than hands-on treatment. And when it became matrons, it became, if you like, even worse. And there was quite a few nurses who they clearly wanted to progress in their profession, but they very much wanted to look after patients and have hands-on contact with patients. So these clinical nurse specialists developed as they were senior nurses, but they were very much hands-on with patients, still in the clinical remit. And of course, that happened in urology. And to start with, they were very much on their own in individual hospitals, occasionally little groups of them getting together. And it became quite obvious that these sort of disparate groups really needed to come together as one, which happened with the British Association of Urological Nursing, BAUN, as it's called, which is still going strong today. And we see the reflection in EAU nursing as well. And I think what you see is the importance of these clinical nurses. Historically, there was a fear that they would be taking over from the doctors, or they would not be able to do a good enough job. Now, of course, certainly in the UK, we can't run our departments without them. We work together as a team. There was a big fear of taking experience away from doctors in training, the junior or resident doctors. And again, we know that's completely wrong, because the nurses often will help to train our resident doctors now with the skills that they've picked up. So, yeah, we all work together, and that's the way it should be.
Nice tribute to the urology nurses as part of the exhibition then. And a third part of the exhibition, it's tied to the Ernest Deneau Prize for contributions to the history of urology. The winner of the prize will only be announced at the opening ceremony on Friday evening, so we can't name names yet. However, if you have been following the news on our website, you might have seen that the EAU received a very generous donation from the Gilvenet family of Barcelona, a collection of medical drawings. Jonathan, can you describe the significance of this collection?
I mean, these are nothing short of amazing. So this was a collection of images which are anatomical, in fact, histological or pathological. So they're at the microscopic level, often related to urology. They look like photographs, but these are hand-drawn and hand-coloured. And it was an amazing piece of work. So under a microscope, this was in Barcelona, they managed to magnify what they were seeing and project it such that medical artists and medical professionals could copy the exact image that was seen under the microscope. They were then beautifully illustrated, and the detail is phenomenal. And really, it just shows how forward-thinking the Gilvenet was when he produced this. And of course, we're well aware there's certainly more than one Gilvenet in the family who was very important in the history of urology. But from a point of view of the EAU and the EAU History Office, the contribution of the family is really very, very generous indeed. There are about 400 images. We are now beholden to look after these in perpetuity, which we clearly will do. This is one of the functions of the History Office. We do get offered some beautiful things usually by retiring urologists or their families that are really important in the history of urology. And it's only associations like the EAU that have the ability to keep these, to allow them to be shared with the world and not kept in private collections, really to continue the education in the history of urology, which I said before was linked with urology itself.
Well, that's a nice preview of what we have in store at the exhibition. Do come visit it. It's part of the EAU booth D14 at the EAU26 Exhibition. There will also be a little scavenger hunt, so people can take a close look at the items to find answers to the questions and perhaps win a very modest prize. And we will have some opportunities for guided tours at set time. So keep an eye on the published times, and who knows, you might meet Jonathan. He can show you the punch in person.
I'll be delighted.
Other than the exhibition, we have an abstract session. That's abstract session 13 on the history of urology. That's on Saturday, the 14th of March. from 12:15 to 1:45 at the red area, room 7. Jonathan, I believe you're moderating that session.
I am, and I'm very, very much looking forward to that. Always a complete potpourri of the history of urology. So it's I will have gone through all the abstracts and to see what I'm to look forward to. But it's always a great delight when they come in to be marked to see the variety and the ideas that people come up with. And often it's the more junior members of our junior colleagues that do this. And it's lovely to see how they get into the history of urology. We often encourage the best ones to then publish it into the De Historia, which is the History Office journal, which is going online.
And rather than a thematic session this year, we will have talks part of the plenary sessions and a thematic session. The plenary session is on Friday at 8 a.m., Cutting Edge Developments in Functional and Neurourology Shaping the Future. But our chairman, Professor van Kerrebroek, will be looking into the past as well. He will be speaking on functional and neurourology from a historic perspective. And then also on Friday at 11:15, there is the thematic session, 5 Top Tips for Genital Surgery. And the talk there will be by a certain Mr. Jonathan Goddard. What can we learn from past mistakes in genital surgery? And Jonathan, what can we learn from these past mistakes?
Well, as I indicated earlier, really the answer that it was an interesting title to be given. And really the answer is we've learned everything from what goes wrong and right in the past. It's like the old quote about standing on the shoulders of giants. We can't progress without learning from what went before. But I've had to pick a couple of things. And so one thing I was interested in was the almost craze of universal circumcision, which came from America, the UK, English-speaking countries, really, that started in the 19th century and really towards the end of the 19th century and the early 20th century, there was this almost fanatical desire to circumcise all baby boys. And looking historically, the things that it was based on were really absolutely incorrect. And so that in itself is a very nice little story about just being careful about what you listen to. And then then the next point I was very keen to look at was in the 1920s, another big push. And this was for the use of animal testicles to help virility and sexual function in men. Again, we now look back and say that was absolute rubbish. But at the time, that was what people thought was cutting edge science. So we can always learn from the past about what to do, but also what not to do.
Who knows what we will be looking at back on in 30, 40, 50 years that we're doing today. Yeah.
It's a worry.
Well, thank you for your time, Jonathan.
A pleasure.
I will see you in London and hopefully see a lot of our listeners in London. We hope to have a very successful annual Congress.
Lovely. See you then.
See you.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on the urological advancements, be sure to subscribe to our EAU podcast channel on your favourite podcast app. Until next time, keep learning and stay inspired.